Semmelweis was a Hungarian physician who was born in Hungary on July 1st of 1818. In 1837, Semmelweis began studying law at the University of Vienna, where he later switched to medicine. He was awarded his doctorate degree in 1844 and decided to specialize in obstetrics. Today he is known as one of the great pioneers of antiseptic procedures and has been named the savior of mothers. In 1844, after receiving his doctor's degree, Semmelweis began working at an OB clinic in Vienna. Him and his colleagues soon began researching the issue of childbed fever, which occurred in maternity hospitals around Europe. They discovered that the mortality rates of women giving birth in hospitals were 2 to 3 times higher compared to those who were delivering their children at home with the use of midwives. Although many thought the infection was non-preventable, Semmelweis had a different theory.
During a dissection, a colleague of Semmelweis cut his hand and died a similar death to that of the women with babies delivered by doctors such as himself. From this event, Semmelweis was able to piece together the evidence of infection being transferred from the corpses to those in the hospital. He then required all medical personnel to wash their hands with strong disinfectant before entering the maternity ward. The death rate from that point on plummeted. Thanks to the work of Semmelweis, we are able to have a better idea of how germs can spread from person to person. Hand washing is now not only encouraged, but a mandatory policy for anyone who works as a surgeon, nurse, general practitioner, and not to mention fast food workers. OSHA even has a policy on proper hand washing in the workplace, which states, employers shall provide hand washing facilities which are readily accessible to employees, and ensure that employees wash their hands immediately or as soon as feasible after removal of gloves or other personal protective equipment. Thanks to the work of Semmelweis, countless lives have been saved by simply washing your hands.